So I'm Dr. Beata Danek, and I'm going to show you how we are doing Botox injection on a patient. Botox is still one of the most frequently used cosmetic non-surgical treatment to improve appearance, to get rid of wrinkles that we don't want, that make us look angry and old. Okay, so we have Maggie here. And Maggie, can you present your wrinkles? Okay, frown. Okay, the other way. Frown. Okay, this is her frown line. Then horizontal forehead wrinkles. Okay, and then beautiful smile. Okay, she has very nice expressions, but she doesn't like some of the wrinkles, so we will take care of it. So I usually remove the makeup before the injection. It is not necessary, but we still do it. So I have a syringe with 35 units of Botox. It was freshly made, freshly prepared from the solution. And we're going to be injecting it to Maggie's wrinkles. Okay, so you're going to frown for us one more time. Frown, frown, frown. Okay, this is frowning. Okay, perfect. Okay, it is a needle. She's going to feel it a little bit, but it's very minimal pain. For patients that are very sensitive to pain, we can put numbing medicine and we can apply ice, but Maggie is not sensitive at all, so she's going cold turkey. Okay, here we are. Okay, so we are done. Those little lumps are normal. They usually go away in 5 minutes. They will probably be gone before we finish. Okay, now you can wrinkle your forehead. Okay, all right. We cannot get rid of all the wrinkles. The wrinkles that are right above the eyebrows will probably stay, because if we get rid of all the wrinkles, the eyelids will drop. So the idea of using Botox for rejuvenation is to make you look better, younger, and not to get rid of all the wrinkles, because sometimes working on wrinkles rather than on general appearance makes us look fake and natural. So we are trying to be natural and look nice, beautiful. All right, so now we're working on the wrinkles on the forehead. So again, you see 4 little dots. They will go away. The ones on the frown lines are already fading, so they should be all right. Can you look up one more time, Maja? Okay, all right. Sometimes add a little bit more on this side, because she has more of one more wrinkle here. We can go all the way down, but we can just put 1 unit of Botox in between, Botox on between, so the transition is rather smooth. Okay. And now we're going to be working on Maja's crossfit. Smile. Okay, there are different distributions of crossfit. Some people will have them up there going to the eyebrows. Some people will have them down. Maggie has them in the middle, so it's easy. All right. Okay, we're almost done. She's still smiling. She's still happy with what we do here. And she'll be even happier when it kicks in. It doesn't work right away, so when she wakes up tomorrow morning, she will still have same wrinkles. It starts working in about 3 to 4 days, and the final results are in 2 weeks. So in 2 weeks, we have patient come back and to assess if this was the right amount of Botox. If the patient continue to come every few months, we don't necessarily require them to come back after 2 weeks, because we already know how they respond. But first-time patients are very much encouraged to come back for follow-up, so we know if the amount of Botox and distribution was right. Okay, one more smile. Okay, relax. We're almost done there. I'm going to squeeze out the rest of the Botox here. Okay, we are all done. There's a tiny spots of blood, but there was no big blood vessels. With every injection, bruising is always a possibility. It is very uncommon with Botox, so most patients don't bruise. Those are very tiny needles, very tiny puncture. So Maggie is going to be fine in 2 weeks. We'll show you how she looks in 2 weeks.